Hello everyone, my name is Colin Belenis, and I'm excited to share my DNP project idea with you. And the idea centers around using technology to promote patient engagement, particularly during the discharge process and when they go home. And what I mean by this is enhancing their ability to learn and remember the information that we teach them. So why does this matter? Well, forgetting has consequences. Patients cannot be adherent to treatment unless they remember what we've taught them. The problem is that patients immediately forget 40 to 80% of what we teach. Poor adherence leads to increased healthcare costs, increased readmissions, and of course, poor patient outcomes. So a couple of quick stories to help illustrate why I am so interested in patient learning and education. The first was during my PhD studies in developmental psychology. I had teaching responsibilities, and I often had students come to me saying that they were interested in the material, they knew it was important, they wanted to learn, but they were having trouble retaining all of the information that was being delivered to them. So I took these concerns seriously and started to research best practices for teaching and for learning so that I could deliver material in a way that was easier to understand, but I could also give my students learning techniques that would carry them forth through the rest of their studies. Now flash forward a few years and I'm working in inpatient psychiatry, and part of my job was to develop and teach the group therapy curriculum. I remember early on working there, watching a patient come out of a group therapy session and sit down on a chair looking completely dejected. So I approached her and asked her what was going on and what had they talked about in group therapy. And she looked at me and said, well, it was something about social skills. I know it's important, but I just feel like I'm too dumb to understand what was being taught. Now, in my view, if you have a patient who's motivated to learn, they shouldn't be able to walk out of a class or a clinic or a hospital feeling like they were too dumb to understand their condition and their treatment. So clearly there has to be a better way. We've actually known for a long time how hard it is to remember things. Back in the 1880s, a psychologist named Hermann Ebbinghaus conducted a study on memory, and essentially what he found is that after about an hour, people forgot 50% of what they studied. After 2 days, they forgot about 80% of what they studied. And after about a month, they had forgotten 90% of what they had studied. So the question becomes, how do we help patients overcome this forgetting curve? There was a really excellent review article published in 2013 in the Journal of Psychological Science and the Public Interest by these researchers, Dunlosky et al. They reviewed 10 different learning techniques. They rated them as being of poor utility, of moderate utility, or of high utility. Now there's 10 techniques here. I won't cover all of them. I'll just focus on a handful. The poor utility techniques include things like summarization, just trying to summarize what you just learned, highlighting and underlining, rereading, keyword mnemonics, and imagery for text. Now moving on to the moderate utility learning techniques, those included things like elaborative interrogation, self-explanation, and interleaved practice. The high utility techniques included things like practice testing and distributed practice. Sometimes people ask me, well, what about teachback? Where does that fall on this? So teachback is one of the most useful techniques that we use in practice. But if you think about it, it's really just summarization. We teach the patient some material and they summarize it back to us. Now it has some added benefit in that summarizing it to a nurse or a provider allows us to identify areas where they might have misunderstood something. But again, it's summarization, and it has limits. So can you imagine how well we would do if we developed ways to incorporate more high-utility techniques into patient teaching? Right now, we're leaving a lot of tools on the table. Even among the moderate utility tools that we do sometimes use, we could be doing a better job. Take self-explanation, for example. Self-explanation involves a patient or a person taking some information they've just learned and applying it to a new problem. An example of this in practice might be a cardiac patient learning about the cardiac diet and then looking at their own dietary history and figuring out how they can adjust their grocery shopping list and their recipes to better fit with the cardiac diet. So sometimes we use this utility better than others, but it's something that could definitely be more widespread. For example, in standard discharge paperwork, patients could have to fill in information about how they're going to apply their discharge teaching to their specific life circumstances. So in the next couple of slides, I'm going to look at practice testing and distributed practice in a little bit more detail. So what is distributed practice? This forgetting curve represents what happens when a student just studies information one time. In distributed practice, students study material multiple times. The forgetting curve becomes less steep. In other words, if a student just learns the material once, they forget rapidly. If they learn the material 4, 5 times, they forget much more slowly. And there's some mathematical models that suggest optimal intervals for rehearsing information that you want to learn. So the problem is, we're not always with our patients. Even the most dedicated among us are not going to follow our patients home and teach them whenever they need it. Practice testing is a term we're all familiar with, but in the literature it's often called test-enhanced learning or the testing effect. So this is some data from one study examining the testing effect. And basically there were 2 groups. In one group, they were able to study for an hour. In the second group, they studied for 30 minutes, and then they took a practice test. And what you see here is the study group essentially was able to cram in a lot of information. And so they initially scored higher on a test. You can see here, they actually retained about 80% of the information, whereas the study test group retained about 75% of the information. However, over the next couple of days and the next week, the study test group retained much more information than the study group. If you think about the way we currently approach patient teaching, we're really putting all of our patients in the study group. At best, they might remember the information when they're with us, but then they're going to quickly forget it. By not incorporating practice testing into our patient teaching, we're really doing our patients a disservice. Again, we have the same problem. We're not going to get our patients to come back to the clinic to take a test 2 days after discharge. So these are results of another study examining medical students' ability to retain information over the long term. All the participants were taught about myasthenia gravis or status epilepticus. They were all given an exam on the material after learning it, and they were all told there would be a final test on the material at the end of the semester. The difference between the groups, however, was that one group was given 2 additional tests on the material soon after learning. The other group was just told to study the material. In the group that had the testing, they remembered about 42% of the information, whereas the group that just studied remembered about 31% of the information. And in the myasthenia gravis topic, the group that had tests remembered about 36% of the information, and the group that just studied remembered 20% of the information. Now, I just want to emphasize, these are medical students. They're highly intelligent, they're highly motivated, and they're still struggling to learn the material. And we can see that practice testing makes a huge difference. Motivation is one thing, effective learning techniques are another. Clearly, practice testing promotes learning. But this is not something we typically do with patients. So how can we incorporate these techniques into patient teaching? One idea is to develop an app. We have apps to help with language learning. We have quiz apps for things like law and trivia. We have quiz apps to help level up your love life. We have apps to help people manage their progress and track their habits. We even have brain training apps that have become a billion-dollar industry because older adults want to help prevent the effects of aging on cognition. And this is a billion-dollar industry despite the fact that they really have no effect. Some people have asked whether an app for patient education is well suited for older adults. And I see these brain training apps as proof that older adults will use the apps as long as the motivation is present and the apps are designed well. But what do all these apps have in common? They all use testing to promote learning, and they all incorporate games to promote motivation. And they also have triggers to remind patients to engage. So I just want to briefly share with you what I think our app might look like. Our app would have 2 faces. One face for the nurse or provider and one face for the patient. During the discharge process, the nurse or provider could select relevant diagnoses and medications. Based on the selections, the app would populate different questions and materials for the patient to review. The patient would then use the app, reviewing the materials given to them, to answer quiz questions. And in order to complete the discharge process, the patient would have to pass the quiz. Now, this app is not a substitution for patients engaging with providers. It's a tool that will help facilitate engagement with providers. Often people don't know what they don't know until they're given a question. And so if a patient gets stuck on a question, they can use this as a tool to interact with their provider. For example, a question might ask a patient, how they should adjust their insulin dose if they get sick. Now, a new diabetic might not know the answer to this question, and so they could then use this as an opportunity to ask their nurse for clarity. Once the patient goes home, they could still log into this app, and the app could provide triggers to remind them to take quizzes and answer questions based on this algorithm that we have developed based on the forgetting curve. So at first, patients might receive triggers and take quizzes very often, but after practicing successfully a few times, the review intervals would get longer and longer. It's important that patients find the app pleasing and easy to understand. And we can also incorporate rewards to motivate patient engagement. Depending on the facility, maybe patients could receive $100 off their bill for completing 100% of the quizzes assigned to them. Thank you for taking the time to listen to this project idea. I really look forward to any questions or comments you have. I'm definitely looking for feedback and any ideas for how we can make this app better.